This is part 4 of Journey Out of Autism featuring Irie. Please like and subscribe to my channel for more videos.
I did a developmental assessment on Irie, and she was referred for suspected speech and developmental delays. She was evaluated on January 29, 2021, using the revised Brigant's Diagnostic Inventory of Early Development 3. This test is used to assess developmental skills in children from birth to age 7. At the time of testing, she was 3 years old, 1 month. She was not very cooperative during the testing session. She was accompanied by her mother to the testing session. She was very active and required a lot of redirection from her mother and the other testers. She ran around the room and refused to sit in the chair. When the mother tried to get her to participate, she became fussy and threw tantrums. She made very little eye contact and only responded to things that she was interested in doing. Her physical development, it was reported by her mother that she's not experiencing any problems in gross motor skills. She can run, hop, jump, and throw objects without any problems. Her fine motor skills, she was able to build a 3-block tower, but that was after several trials and several coercing her to play with the blocks. She consistently used her right hand to perform tasks that she liked. She held a crayon with her fingers to make a few marks on the paper or to somewhat scribble. When the tester and the parent tried to give hand-over-hand assistance, she refused help. She pushed her hand out of the way. She pulled her hand away from us, and she tried to get out of her mother's lap. She was unable to cut and copy forms as she did not comply with most of the fine motor skills that we asked of her. Her language development, during the testing session, she spoke very few words. She would either point to or pull her mother or go get things she wanted to get her needs and wants met. And it took her several attempts to follow one-step directions when we gave her a direction. It took her several tries to get that because she was on her own little world. Her daily living skills, that's how she, her self-help skills. The mother reported that she's not yet potty trained and does assist with undressing herself. You reported that she does not like being touched, but she will walk up to people and rub them. The mother reported that she drinks from a bottle and has not shown any interest in drinking from a cup. She prefers to feed herself with her fingers. When it comes to her academic level, she was able to match a 6-piece puzzle and turn pages in a book. Her social emotional level, she was very self-directed and strong-willed. She had difficulty transitioning from one activity to another, and the tester observed Irie briefly interacting in a turn-taking game with her tester and the mother, but that's after we had to coax her into the area, and it was something that she wanted to do. We had to get her attention. So my conclusion for this testing, because like I said, most of the stuff was random because she was really strong-willed and she was doing what she wanted to do when she wanted to do it. So according to the developmental assessment and the parents' input obtained on January 29, 2021, she is showing strength in her gross motor skills and some fine motor skills. She is demonstrating weaknesses in the areas of language development, her academics, social emotional development, daily living skills, and academic skills, and some academic skills. It is my recommendation that Irie would benefit from specialized design instruction at this time.
So I did my observation during the developmental testing, so a lot of the information is part of what Ms. Bennett said, so I'll brush over and try not to repeat as much. Like she said, Irie was in constant motion doing testing, and she didn't respond to adult-directed testing. A lot of things was self-directed, what she wanted to do, but she did become comfortable and playful with us, and she engaged in a lot of different activities. She had a short attention span, so she would play with something, then move on. It wasn't like she would constantly stay on one thing. She would smile in response to praise and interaction and laugh with us, and she even got at Miss Bennett because she didn't clap when she was supposed to. She made limited eye contact and did not appear to directly look at her surroundings, but still remained aware of what was going on around her and what others were doing.
I'm going to read review the OT evaluation that was completed by my partner, Hope Sadowski. A lot me with the case history form in which she completed in order for me to get some type of developmental history on Irie. And Mom reports that her most difficult problem in the home is her speech. Most of her verbalizations are songs in which she repeats all day. And she loves to sing and listen to the musical tones. She does not verbalize her needs, but she will walk her mother or father to what she wants or needs. She's a product of a full-term pregnancy and delivery, and she is currently a healthy child that has not had any medical emergency, and she's not under the care of a physician at this time or taking any medication. All her developmental milestones appear to have been delayed, with the exception of walking and grasping a crayon or a pencil. As far as babbling and saying her first word, those speech skills were delayed. She is able to repeat sounds, words, and phrases over and over and understand what is heard. She is unable to retrieve or point to common objects upon request and follow simple directions. And these are skills that Ms. Brown has reported. She has difficulty responding to yes or no questions and to WH questions. She currently communicates using body language. Behaviorally, she's described as cooperative, willing to try new activities, sometimes stubborn, and easily distracted with a short attention span. I gave her or attempted to, it was mostly through observations and informal testing that I was able to give her the preschool language skill and the structured photographic articulation test. As far as the PLS-5, it's a diagnostic tool for the assessment of children's communication skills. Her auditory comprehension language standard score was 50, and that's a very poor score. She to be within the average range, it needs to be at least a 90, and she scored a 50. So that's at a very low area. She had weaknesses in the areas of attention, attention to people, gestures, play, vocabulary, for her age level. Expressive weaknesses were identified in the areas of vocal development, social communication, vocabulary, and syntax. So her total language, once we combine her expressive communication, her auditory comprehension, was a standard score of 51. Again, this is within a very poor range. And she did not indicate skills that allow her to convey her thoughts and needs within an age-appropriate manner. The conditions of her voice, fluency, and oral motor skills could not be obtained. You couldn't pin her down to do that. She didn't express any interest in communicating with me. The other examiners ran around the room with her. I did not. So she didn't have any interest in me. And she did not answer any expressive or receptive questions. Ms. Brown reports a hearing evaluation was conducted in Florida, and hearing acuity was determined to be within the normal range. And Ms. Brown does not have any concerns at the time with her hearing. Observation of her behavior indicated selective hearing patterns. She heard what she wanted to hear. She would not respond to noises that as we were expected them. For instance, we did phone tones around the room, and she would not respond to any name calling, any clapping, or any squeaky sounds. But when the intro music to Little Bill was played, her ears perked up and she could hear that. And so it was, so we realized that she was hearing selectively what she wanted to hear.
Yes.
Okay. So I mean, she does have some communication weaknesses, and I am definitely recommend that she receive speech and language services to aid her in improving those skills. Any questions?
All right, well, I am not going to repeat any of the information. I did do a developmental also, and my results were exactly the same as what everybody else had. She does have a lot of developmental delays, specifically with fine motor adaptive behavior, social, emotional, cognitive, and communication. And I don't need to do anything additional with all of that. You all covered kind of that whole observation arena. But I did ask Mom to complete an autism rating scale just because autism was definitely a concern. And I know that all of us, just kind of everybody has shared different kinds of behaviors that she exhibited throughout the testing session, both with us and then with Ms. Radloff, the occupational therapy report that she read. So the rating scale is for children ages 2 to 5. And then the parent just kind of rates kind of each behavior based on their experience and observations with the child. So overall, there are 2 different overall scales. So there's like this total scale, and it ranges, average ranges from 59 and below. So anything below 59 is within normal limits, and anything above that is a concern. And so the ratings, the T-score was a 67 for the total. That was at the 96th percentile and fell within the elevated score range. So Irie does have a lot of behavioral characteristics that are similar to a child who had been diagnosed with an autism spectrum disorder. And then there's a DSM-5 scale, which kind of looks at the DSM-5 characteristics and categories that someone would need to have in order to be medically diagnosed. And this is not a medical diagnosis, but the rating scale did fall within the very elevated range, which says she also has a lot of symptoms that would meet the criteria. So if you all take her back to the doctor and take all of this information, they may be able to use it to kind of support that. Let's see, and just looking at those characteristics. So there's social communication and then unusual behavior. So social communication kind of looks at language and how she interacts with people. As far as peer socialization, it's how she kind of engages in activities for peer relationships. And while Irie likes to, she did a lot of parallel play, and even though we weren't children when we were in there doing the observation, we were all engaged in kind of preschool aged activities, and she would kind of play alongside of us, but she would never turn take with us. It was very rare for her to do that. She'd throw a ball and we'd throw it back to her, and she might chase it and throw it, but then she was done with it. She wasn't interested in a lot of turn taking. Also with that turn taking with communication too. She doesn't do a lot of that. Stereotypical behaviors, she did spin a lot. I didn't necessarily observe a lot of hand flapping, but I know that was something that everyone has kind of talked about. The scripting, she does a lot of scripting. That's the singing of the songs, but not really using language in a purposeful manner. So she did a lot of that. And then, of course, just that whole joint attention. I mean, we would all try to get her attention to do something, and the only thing that would get her attention was little Bill. And we were able to do a lot of things with little Bill. We kept her shoes on with little Bill, so that was a good thing. But she was, she was fun to be around. She was fun to observe, and she has a lot of emerging skills that I think, she's got a ways to go, and life isn't necessarily going to be peaches and cream after she gets services, but she definitely has a lot of emerging skills. She's got a nice personality, especially when you're doing some things that she's interested in. And, I don't think that the delays will be hindering her forever. I think she's going to come a long way pretty quickly with some interventions.
What we like to consider first, a developmental delay, or what we like to look at an autism spectrum disorder. Mom and Dad, the state of Virginia has checklists for disability categories, and we would like to go through at least one or two of those. And also, Ms. Good, if you could be thinking, Mrs. Brenda Good, do you feel that the delays that you're seeing? Are they related to another disability, or you feel we need to investigate a standalone speech language impairment?
I have a quick question.
Yes, sir.
With her saying that, like, because I also believe that, you know, she's going to progress and later on, you know, she's going to be fine. So with her being able to progress and come along just fine, would that still make her fall under, you know, autism, or fall under having autism, being that she, you know, will develop and, you know what I mean, live a normal life, so to speak?
Certainly. So, I mean, autism is a spectrum disorder. So generally speaking, if someone is identified with autism at an early age, they usually carry that throughout their lifespan, but they learn to cope with it. They learn strategies, and it does not generally hinder them, some of them, later in life. There are some of them that is very debilitating, and they need services well into adulthood. They're not independent, while others may need a lot of services in the beginning, and then by the time they get to adulthood, they don't need any additional supports. They just need some accommodations or modifications to their environment. They learn how to advocate for themselves to get those needs met. They still may have some social difficulties, or they still may have some communication difficulties, but generally they're able to function independently. And there are children who we have found eligible for autism at an early age, and by the time they get to high school, they really don't need those services.
Yeah, that's what I'm.
Yeah. So every 3 years we have to reevaluate anyway.
Okay.
There are times when we may think that she may need additional services. It could be that when she gets into second grade and she's having difficulty grasping reading, we may need to consider additional services for like a learning disability. That's just as an example. That may not happen, probably won't happen, but it's just, you know, we have to meet her needs academically and educationally. And at any time that somebody feels like a change is necessary, we need to come back and kind of consider that request and then figure out what we need to do, how to resolve that. So it could be more testing and we find her ineligible, or it could be more testing and we find her for a different disability category. It's hard to predict just because she's so young. And, you know, there's no way to kind of predict some of that. You know, I don't know if that doesn't necessarily answer your question, but
the retesting part answers it. Makes sense
Okay.
to me.
Yeah,
Because even though she's like that now, then in the 3 more years, then when y'all may test her again, it's nothing. So
right.
Absolutely.
Right.
That's correct.
And thank you, Ms. Harris. And one more thing, keep in mind, parents, when you give a school division consent to provide services, we'll develop an individualized education program for Irie, and at least annually, that plan will be reviewed by a team that includes you, her teachers at that time, and the case managers and whoever else are the service providers. And you all will tailor it based on what she needs as far as her strengths and weaknesses, not necessarily based on what her identification is. So the services can range from something that's rather intense she might need now. She might need an early childhood special education class now, but as she progresses later, our goal is for her to spend more and more time with her general ed peers. So she may at some point in time later, yes, she still has an identification with autism, but she's in the general ed classroom that's a collab classroom. So her IEP is just written for her to have additional supports. Maybe later on, she's just monitored. So it's not so much the identification that drives her services, it's that individual plan. And at any point in time, even though it's reviewed annually, you all can request for the team to look at it. Maybe you need to pull back on some of the strategies. Maybe she's generalized them and maybe you need to try something else, or maybe, you know, it's not written in stone. So both of you try and look at it. It's not so much the identification that drives what the services will look like in public school. It's more of what that IEP looks like. And that's looked at least every year. So if that helps some.
Okay, yeah, that helps. Thank you.
Thank you.
And you all can always at any point in time say, you know what, thanks you guys, it's been great. We don't want her to have any more services, and that's it. But it's better for her to have that support, and as it was explained by Ms. Harris and others, to make changes to meet her needs, her strengths and weaknesses as it goes along.
Thank you.
Yes, ma'am.
So, Ms. Harris, what do you think we would like to look at? Would we like to look at developmental delay, or would we like to look straight at autism?
Straight. Just looking at autism, I think that's kind of what everybody has seen, everybody has described. I think it was hard to assess developmentally just because of her preferences and things like that. So I'm more comfortable with, I'm not uncomfortable with looking at developmental delay, but I don't think I think she would, I'd like to go through this one first, I guess is what I'm saying.
And before Ms. Harris walks us through this information, this is good. Do you feel that you want us to look at speech language impairment as a separate identification?
You're on mute.
I am.
No, Miss Good's on mute. It looked like she was talking.
I am. Sorry about that. If we're looking at autism, and we get to the bottom and that says yes, then definitely speech is a characteristic of some of the traits of autism, and I would like to consider speech as related to the autism.
All right.
Okay.
So step one with the checklist, it's a definition. And so autism means a developmental disability significantly affecting verbal and nonverbal communication and social interaction, generally evident before age 3, that adversely affects the child's educational performance. Other characteristics often associated with autism are engagement in repetitive activities and stereotyped movements, resistance to environmental change or change in daily routines, and unusual responses to sensory experiences. Autism does not apply if the child's educational performance is adversely affected because the child has an emotional disturbance. A child may manifest the characteristics of autism after age 3, could be identified as having autism if the criteria and the definition are satisfied. So in step 2 is where it kind of breaks everything down a little bit. It talks about the characteristics of autism. Children with an autism spectrum disorder demonstrate the following characteristics across multiple contexts. So the first of 3 different characteristics, impairments in social interactions, such as marked impairment in the use of multiple nonverbal behaviors, such as eye-to-eye gaze or facial expression, body postures, and gestures to regulate social interaction. Failure to develop peer relationships appropriate to developmental level, and this could be greeting and sharing information in a manner that is appropriate for the social context. A lack of spontaneous seeking to share enjoyment, interest, or achievements with other people. This includes lack of showing, bringing, or pointing out objects of interest, or a lack of social or emotional reciprocity are noted, and this includes an abnormal social approach and a failure of normal back and forth conversation. And from everyone's reports, we talked a lot about that kind of, those kind of behaviors. So that one we could definitely check. The second characteristic is restrictive, repetitive, and stereotype patterns of behaviors, interests, and activities, such as encompassing preoccupation with one or more stereotyped and restrictive patterns of interest that is abnormal either in intensity or focus, apparently inflexible adherence to specific non-functional routines or rituals, and this could be difficulties adjusting her behavior to suit social context, or stereotyped and repetitive motor mannerisms, persistent preoccupation with parts of objects. Excuse me. And so we can check that one. She did a lot of, I know for us, when we observed her, she did a lot of spinning. I know her family talked a lot about the hand flapping. She does have a lot of difficulties with that routine. She doesn't like to change what she's doing to do something else, and she'll tantrum as a result. And then the third box is just impairments in communication, such as a delay in or total lack of the development of spoken language, not accompanied by an attempt to compensate through alternative modes of communications. And this could be gestures or mimes. In an individual with adequate speech, marked impairment in the ability to initiate or sustain a conversation with others, stated, stereotyped, and repetitive use of language or idiosyncratic language, such as difficulties with understanding what is not explicitly stated, utilizing communication for social purposes, changing communication to match the situational context, or following conversational rules, or a lack of very spontaneous make-believe play or social imitative play to developmental level is noted. And we talked a lot about that too. And so scrolling down, so she met those three characteristics that step 2 is true. Step 3, the child's educational performance is not adversely affected because she has an emotional disturbance. There was no evidence of any emotional difficulties. Step 4, there's documentation of an adverse effect on her educational performance due to one or more of the documented characteristics of autism. And here is where we'll describe, again, just going into detail about some of the behaviors and how it kind of impedes her ability to show what she knows. Also, just her social communication and her social interactions with others. And then some of her developmental concerns. And then in step 5, that's where we would determine that as long as she meets all the other criteria and we feel that she needs specially designed instruction, then she would be eligible as a student for special education and related services for students with autism. And I think both, she does need the occupational therapy, speech therapy, and then just some supports academically appropriate to her level. To be able to make developmental gains. Any questions or concerns? And as you get the paperwork and you go through, especially if you go through this checklist and you don't, some of the language or some of the descriptions don't make a lot of sense because it's written in educational jargon. If you want, I'm happy to kind of talk about it and give you more information about it. So feel free to reach back out and we can kind of talk through it again. So I know it's a lot of information in a very short period of time. So I'm very happy to.
So this is December 10th, 2020. Just a couple days before her birthday, December 22nd. She will turn 3. And this was where she was at this point. We are still on the meal plan, and her progress with reading is improved, and talking, as you will notice throughout the video, that she starts reading. She's actually turning the page. She's actually engaged in what she's doing, and she loves this book so much. We've had it since she was born, so that's why the cover and all this looks so bad. Irie is actually in the room with me now, so if you hear extra voice, that is Irie. But I am so proud of the progress she's showing now. On this particular date, December the 10th. Like, honey, you're a treat. You're my baby bumblebee. You are so very sweet. You fill my days with lots of joy. Like honey, you're a treat. You're my caterpillar. You're ticklish through and through. I love to make you giggle. You're my caterpillar. You're ticklish through and through. I love to make you giggle, and you make me laugh too.
I'm your treat.
Good job, baby.
Here I come to the terror.
Ticklish through and through.
I want to be the little human. That treat.
Good job.
Like a star. Bright in the sky.
Good job. Turn the page. There's.
Star butterfly.
That's right. Beautiful, my darling butterfly. There's no one who's more beautiful, my darling butterfly.
You are a butterfly.
Good job, baby. Turn the page.
The blood. It's in.
Good job. Turn the page.
And
Good.
Thank you guys so much for watching. Please share, like, and subscribe for more videos.